I'd like to introduce our final speaker of the day, which is Apryle Horbal from the University of Edinburgh, who's a resident in equine dentistry there. Thank you very much.
There we go. All right, perfect. Well, thank you all for being here, to sticking around till the end, and thanks to BIVA for having me. I'm going to be speaking about infundibular caries today, which has compromised most of my research since I've been at Edinburgh. And trying to decide if they're significant or not is still a question I'm asking myself now. There we go. So in equine maxillary cheek teeth, which is what we're speaking about specifically today, there are two crescent-shaped infundibuli in the middle of the teeth. There we go, sorry. And they're intended to provide a greater length of enamel ridges to kind of balance out all of the more complex enamel ridges in the mandibular cheek tooth that's on the bottom of the screen there. They are enamel invaginations from the occlusal surface, and they form deep to the apical aspect of the tooth. And the question is, should they be completely filled with cementum? Technically, they should be, but actually we find in reality in most cases they're not. In some previous studies that have been done before, by Fitzgibbon in 2010, she showed that 88% of teeth had an infundibular cemental defect on a pathological study, whereas Windley in 2009 showed that 90% of teeth on CT scan had defects in their infundibuli. As far as infundibular cemental lesions are concerned, they're kind of broadly categorized into these different areas. They're present in almost all horses, one type of defect or another. Caries being reported in 8 to 97% of horses, a huge range, basically depending on how the author of each study has defined what caries are. 47% of these caries are in the triad 09 position, the usual suspect as we call it, the typical one that causes issues. Linear defects that are caused or related to these central vascular channels in the teeth that form during development are present in 58% of teeth. And developmental cemental hypoplasia, or big defects at the apical aspect of the teeth in the cementum, are present in a lower percentage of horses, 23%. As I was just mentioning, these central vascular channels that occur in the middle of the infundibuli, they're from the vascular supply that forms from the apical aspect of the dental, or the occlusal aspect of the dental sac during development of the tooth. And they contribute vasculature from the occlusal aspect of the tooth. A recent study published by Susky just now from Karsten Stasic's group showed that kind of at the more apical aspect of the tooth, however, there are lateral arteries that contribute and provide supplementary access, let's say, to the central vascular channel. There's not one particular central vascular channel at the more apical aspect of the tooth providing its blood supply, which has something to do with how the cementum forms in the tooth after it erupts. And then incomplete cemental fill in the central vascular channel and in its branches, these lateral branches, allow impaction of feed material and debris once the dental sac has broken down. In a study by Chris Pierce published earlier this year, actually, he showed that this patent infundibulum actually can be a direct cause of apical infection in horse cheek teeth. Basically, it requires the infundibular cementum to be incomplete and also there to be an opening in the apical aspect of the enamel of the infundibulum. And that allows the feed material and bacteria from the oral cavity to pack to the apex of the tooth. Then if the enamel is incomplete, it allows this periapical infection. And it's important to note this. It's periapical infection without endodontic infection. So you may have pulp horns that look completely normal, but have periapical infection of the tooth. As far as infundibular disease is concerned in a more normal infundibulum with a sealed enamel apex, it involves cemental hypoplasia, whether it be through the linear defect or from a more complete apical hypoplastic defect, which then allows impaction of food and debris that form complete caries that may then coalesce and lead to structural weakening of the tooth. Hanma and then Dacre created a system in which to grade these caries, with one involving just the cementum and then progressively extending to enamel, dentine, and then this coalescence that weakens the tooth. And then the extension of caries, of course, is what we're actually worried about clinically speaking. When they coalesce and weaken and then allow the tooth to fracture, creating a periapical infection, tooth root abscesses, and then potentially sinusitis as well. Previous studies have shown, though, that this occurs in a relatively small amount of horses, with 16% only of apical infection being related to infundibular infection, and in this study that was direct endodontic infection from the infundibulum. And this often then, of course, leads to sinusitis. And then in cheek tooth fracture, it's reported in only 0.4% of horses in practice. And when this study was performed, both these midline sagittal fractures and slab fractures were all categorized as idiopathic cheek tooth fractures. So that 0.4% represents all of those combined. And then 23% of that 0.4% were these midline sagittal fractures that we have now directly related to infundibular caries. So overall, we know that a lot of horses have these cemental defects, but really not many end up with these clinical sequelae. So what we need to determine is when these infundibular caries become significant, since they are so common. Why are they so common? Are defects incorrectly understood and identified, which yes, I think they definitely are, and what factors contribute to these defects leading to clinically significant sequelae. And once they're identified, we need to decide how we treat them and when we treat them. So in an ongoing study that I'm performing, it involves gross examination, CT scan, gross pathology and histopathology, and even some micro CT to characterize these infundibular defects. Currently, I'm looking at 82 cheek teeth from 30 cadavers. There's no evidence of secondary complications related to dental disease in any of the specimens that I've harvested. 72 of the teeth have grade 1 through 3 infundibular caries, and then 10 control teeth with no evidence of occlusal surface caries were also selected. The infundibuli were identified as rostral and caudal to analyze as well, and their caries were graded. As you'd expect, there's quite an overrepresentation of 09 cheek teeth. Trident 09 much overrepresented in all dental disease, as we know. And as far as the age of horses is concerned, a pretty broad representation of age groups, or even representation of age groups, but of course skewed away from very young horses that haven't really had time to develop caries yet. On CT scan, a variety of variables were analyzed and collected. The CT scans were very easy to analyze: crown length, the infundibulum depth, any carious lesions and where they occurred, any defects in the cementum and where they were localized, and also was looking for cemental defects other than caries in particular, things that weren't related to occlusal surface caries.